Hey class, welcome to Basic Elements of the Medical Word. I know that this week we are supposed to be going over chapter 4 and I believe chapter 5, but I wanted to go back to chapter 1 and address certain sections of it because it's going to be very important that you guys are able to understand the concepts for the rest of the course. So basically, chapter 1 covers the very foundation of medical terminology. We'll go over word roots, we'll go over suffix, prefixes, so on and so forth. But I want you guys to be able to understand the process in which medical terminology is formed so that in the coming chapters, everything kind of will make sense plugging together. Okay, so that being said, let's go through. All right, so medical terminology is basically going to be the language of medicine. Whether you guys are deciding to be a radiographer, whether you're choosing to be a nurse practitioner, a nurse, whether you're choosing to be a physical therapy, the language of medicine is very different. It's kind of that professional language versus street talk, right? You wouldn't go into an interview and tell your interviewer, hey, getting here was a little sus, right? You wouldn't say that. You wouldn't say, yeah, I'll be right there ASAP. So the same way you wouldn't use certain terminology during an interview, you would not use certain terminology in the medical field. So when we're talking about the language of medicine, we are going to be talking about this main things, all right? We're going to be talking about the word root. We're going to be talking about combining form. We're going to be talking about suffix, and we're going to be talking about prefix. What does that all mean? Well, let's go through it. So the main element that I want to talk about is the word root. Just like everything in life has a beginning, this is the beginning of medical terminology. It will be the foundation that contains what the actual word means to begin with. So it is derived from Latin and Greek. It's very important that you guys know this, okay? Throughout the slides, certain slides, I will have bold information. If I were you, I would pay attention to that bold information and pay attention to a lot of, if I harp on something or I repeat something multiple times, chances are you're probably going to see it on a test. That being said, I understand that we didn't have chapter tests for chapters 1 through 1, 2, and 3. That doesn't mean that you're not going to see this information again, because you are going to have a midterm that is cumulative. So that means that information on chapter 1, 2, and 3 will be covered in your midterm. So it's important that you guys do learn this information, because not only for the test purposes, but you are going to utilize this in your daily lives as you progress through the medical field. You're going to need it in anatomy and physiology 1, anatomy and physiology 2. You're going to need it in positioning. You're going to need it in every part of your careers. So it'll behoove of you to learn it here. But anyway, back to the slide. The word root, from here on forward, we'll just call it WR. It's usually derived from Latin or the Greek language. At least one word root is most medical words, okay? Some medical words, such as heart and blood, derived from early versions of the French or the English language, which won't have a word root. Examples of word roots, okay? So we got hep or hepatitis. You got tonsil, tonsillectomy, gastro for I hate that one, so I'm going to skip that one. But larynge for laryngitis, and so on and so forth. So let's take, for example, what is the word root for liver? It will be hepat. Make sure you guys know that. I guarantee you will see that question again. Okay, the word root in a medical term usually indicates anatomical structure, meaning where in the body we are even talking about. So if we go back to the previous slide, if we could, but I'm not going to. So larynge we're talking, or laryngitis, the word root being larynx, we're talking about the neck, right? Larynx, it's already there. Larynx, okay? Here's this chart, you will see it in your books. And it's very informative. It'll help you see the English terms. So we'll start from the top, the skin, okay? The Greek or Latin term for skin is dermatos. The word root is dermat. So for example, dermatitis. It's, you can see how it's kind of falling together. So let's go for kidney, all right? Kidney, the Greek or Latin term for kidney is nephros. Nephros, the word root being neph. And then that's where we will get nephrology and um, anyway, many other diseases from there. The one I really want to harp on is the mouth, okay? Because the Greek and Latin term for mouth is stomatos, which could be confused with stomach, right? It sounds so similar that you want to call stomatos into stomach, but it's not. It's the mouth, okay? So mouth, stomatos is the Greek Latin word. The word root is stomat, okay? Same thing for oris. Oris. Anyway, you guys get it. The next part is talking about combining form, okay? Combining form, or CF, is created when a word root is combined with a vowel known as combining vowel. Now, for those of you that have been out of school for a substantial amount of time, I even provided the vowels A, E, I, O, U. That being said, the most common one is going to be an O, but sometimes an I or an E squeeze themselves in there. It is difficulty pronouncing certain combinations of word roots require an insertion of a vowel. Okay, it has no real meaning of its own, but a combining vowel enables two or more word elements to be connected. Okay, it holds no true value other than combining two words together. Okay, so examples of some combining forms. So we got mammogram, mammography, psychology. We got laryngospasm, hepatomyalgia. This is tough. This one is tough. But anyway, the O is going to be that combining. Again, this is combining those two hard words that without it will be pretty hard to put together. So if we were to take mammogram, it'll be mamgram. I can't even pull it out. Mamgram. It'll be very weird. Same thing for psychology. If we were to get rid of that O, it'll be psychology. It just doesn't make sense. It doesn't sound right. That's where that combining form comes into effect. The next part of word elements is your suffix. It's a word element placed at the end of a word. It changes the meaning of a medical word, and it is contained in most medical words. Usually an indication of pathology, condition, or symptom, diagnostic procedure, or even just part of a speech, we would use a suffix. Now let's go over some examples of suffix, okay, as it pertains to word elements. So we have some, for example, appendectomy. The suffix in this word would be ectomy. Appendicitis, the suffix in this word would be itis. That suffix is basically giving the meaning as to what's happening. So for example, if we were to say appendicitis, we know that itis is defined as an inflammation. So appendicitis would be an inflammation of the appendix, because appendix is referring to appendix. Make sense? So that suffix at the end of every word will kind of give you, like we discussed in the previous slide, the scope of what we're referring to, whether it is a condition, whether it is a test, whether it is just talking about a medical word for itself. So let's go over an example of a word linking a suffix, okay? So let's see if you guys could figure this one out. This is um, which is an example of a word root that is linking a suffix that begins with a vowel. I'll give you a few seconds. All right, hopefully you guys picked the letter D because that's the right answer. If you didn't, maybe just try to look through the book and see what area kind of confused you, and take it from there. All right, now let's go to a different part of word elements, which is the prefix. Prefix, unlike the suffix, will be placed at the beginning of the word. Many are the same as those used in the English language, so that will make it somewhat easy for y'all, but it does change the meaning of the medical word. It is not contained in all medical words. Some medical words have it, some don't. And it usually is an indicator of a number, a time, a position, a measurement, direction. So in the examples, I think it'll make a little bit more sense. And so hyper, okay, hemi, epi, post, inter, so intercostal, inside the costal area. Hyper is faster, versus hypo will be slower. So hypertension will be an increase of blood pressure. Hypotension will be a decrease of blood pressure. So the prefixes tend to be more of a measurement or a trying to let you know a certain position of the body or whatnot. All right, defining medical words. There are three steps for defining medical words. Define the suffix first, okay? Then define the first part of the word root, the combining form, or the prefix. And finally, you'll define the middle part of the word root or combining form. So, for example, and with this is obviously the part two. In the slide deck that is provided for you guys, it'll have the same slide without the red notes so that you guys can practice and then just proceed to the next slide and see if you guys got it right. So it'll show like gastroitis, and then it won't have all this. Let me mark this for y'all. So it won't have this section here on the slide deck. So that'll help you kind of test your knowledge, okay? Yeah, and I think there's going to be a few like this. I think it'll be kind of a waste if I just go through what you guys kind of already are able to go through with the slide deck. There are three rules for building medical words. Okay, rule number one is that word roots have to link a suffix that begins with a vowel. Rule two, a combining form links a suffix that begins with a consonant. And rule three, a combining form links a root to another root to form a compound word. Rule three holds true even if the next root begins with a vowel, as in gastrointestinal, blah, blah, blah. So you can see how building medical words can get very, very confusing, very, very hard to pronounce and kind of follow through if you don't have the foundation of building medical words. So with this example, we can pretty much already start looking at if we break it down, right? So we got gastrointestinal. So with that, we already know that we're talking about the gases within the intestines, gastrointestinal. The more that you guys practice with building medical words, the easier it'll get to recognize them when you see them. So for example, arthritis, rule number one, links a suffix that begins with a vowel, arthritis. Rule number three, an example of that would be gastrointestinal. You can see that Combining form links a root to another root to form a compound word. A root links a suffix that begins with a vowel. And then an example of rule 2 would be hepatocyte. Hepatocyte. Combining form links a suffix that begins with a consonant. So when we're talking about pronunciating medical words, there's this thing called diacritical marks in capitalization. This basically helps you know how to pronunciate certain terms throughout the text and understanding of pronunciation marks used in most dictionaries. Those of you that are going to be pharmacists or pharmacist assistants or anything to do with that part of medicine, you'll notice that a lot of diacritical marks are in capitalization is used on certain medicines that look the same. So when one medicine might capitalize the H, the other medicine will capitalize the T so that you can distinguish between the two medicines because they have such close resemblance with one another. When it comes to everybody else, this is going to help on how you pronounce those words. There are great slides, there are great videos within our program in FA Davis, so go ahead and look through that. It'll be very beneficial so that you guys can get used to how those words sound in real life. So that pretty much concludes the catching up of chapter 1. That kind of sets the foundation for going forward. From here, we will go into chapter 4 and continue progressing through this class as normal as possible. All right, so that brings us to chapter 4. Now we're going to go ahead into body structures. It's going to get a little bit, hopefully a little bit more fun than the previous chapters, because now we're going to start seeing how medical terminology affects all the different areas within the body. All right, when it comes to levels of organization, our body is broken down into certain crawl, walk, run phases, okay? So if we would start at the smallest level, we have the cell, which within the cell you have your nucleus, your atoms, and so on and so forth. From the cell, the next higher up will be your tissue. Many tissues will make your organ. Many organs will make your system. Many systems make the organism as a whole, you being a human. It's kind of a process, okay? Let's talk about anatomical position. I know a lot of people have probably seen the anatomical man, palms forward, facing forward. It's very important that you understand the anatomical position because this is how you're going to describe the patient when you're briefing a doctor or when you're writing reports or so on and so forth. So let's talk about what does that mean. Okay, we're going to be the anatomical position is standing upright, not laying down, not on its side. It's going to be standing upright. Head and eyes directly pointed forward. Upper limbs at the sides, not crisscrossed, and slightly away from the trunk. So you don't want to have them here where you can't tell what's what. It's going to be opened up a little bit. Palms always facing forward, thumbs pointing away from the body, lower limbs parallel, and feet flat on the ground. So this would be a perfect example of the anatomical position. When you're describing this patient, and let's say we were talking about this hand right here, even though as I'm looking at the hand, it is on my right side, so I would want to say, oh, that's the right side. No, that is the patient's left side. Even though as you look at it, it will be your right side, it's actually the patient's left side. It's very, very, very imperative that you get used to describing your patients or the anatomical parts as from the patient's point of view, not yours. You will begin it'll kind of start affecting your personal life because when you start saying, oh yeah, left or right, you're going to want to start saying left or right based on how people are perceiving it versus how you perceive it. It just takes some time, but it's something that needs to happen. You got to get used to it. and it will be 100% beneficial in the long run. When it comes to body positioning, there's a few terms that are very important, especially for those of you that will be entering into the radiology program or the nursing program. Okay, when we're talking about prone, we're talking basically face down on the floor on the table. When we're talking about supine, it's the same but facing upwards. When I was in the military, we used to have this exercise called the supine bicycle, and basically the soldier will lay down like this, bring up his feet, and then just kind of start flutter kicking. That's how I remembered it. However you want to remember it, great. You have your right lateral recumbent. We're going to be talking about the side closest to the floor or the table, which in this case will be your right. Then you have your left lateral recumbent. You got your Fowlers, and then you got your Trendelenburg. Out of all of these, it's very, very important that you guys have to learn this top two. The other ones will be beneficial, but you know, at a very minimum, you have to know what prone means. You have to know what supine means. When we're talking about body planes, again, this is going to be almost very basic necessity to know for those of you going into the nursing field and those of you going into the radiology field. Your mid-sagittal plane is going to be your medial plane, okay? Then you have your coronal plane that separates your front and your back, which it will be this one right here. And then you have your transverse plane that basically cuts your body in half, which would be this one right here. This is your transverse plane, coronal plane, and mid-sagittal plane right here. Body cavities, as we're addressing cavities, you have your anterior, meaning on the front, and then you have your posterior, meaning from the back. You have your dorsal cavities, which consists of your cranial cavity right here and your spinal cavity right here. Then you have your ventral anterior cavities. You have your thoracic cavity, which is right here. You have your abdominal cavity, which is right here. And then you have your pelvic cavity, which sits just about right here. This abdomen and pelvic region will be referred to as abdominal pelvic region. And then this whole area, to include the thoracic, your abdomen, and your pelvic, are all considered your ventral region. Okay, again, like I spoke about in previous slides, these are some exercises that are part of the slide deck. You'll be able to run through them on your own, kind of test your knowledge. But another term for dorsal is called posterior. Another term for ventral would be anterior. The two dorsal cavities, we just went through them, cranial and spinal. And the ventral cavities, we went through them, which are your thoracic and your abdominal, and your pelvic and thoracic as your abdominal pelvic cavity. Okay, let's talk about quadrants. This is a pretty fun slide. I actually enjoy talking about the quadrants. I don't know why, but I just like it. Your abdominal pelvic cavity is divided into four sides. Okay, you have your right upper quadrant right here. Again, as we're talking about this, we're talking about the anatomical man, not the way we see it. So as I'm looking at this, even though this is the patient's right side, I am looking on my left side. So let's not get confused. I'm not going to call this the left upper quadrant because it's my left side. I'm going to refer this as the right upper quadrant because that is the patient's right side. Same thing would be over here, the left upper quadrant, the left lower quadrant, and then the right lower quadrant. This will be acronymed as RUQ, LUQ, LLQ, RLQ. And each quadrant is divided like this because they hold certain parts. We'll get into more of that as we progress to anatomy. But so the left upper quadrant is what's going to hold, for example, your stomach. Your right upper quadrant and your left upper quadrant will house your transverse colon, which is right there. And so you can see how different body parts are housed within different quadrants. So when a patient is describing a pain and they point towards, their stomach, you wouldn't say, hey, patient presents to clinic with chief complaint to stomach pain. You would address that as patient presents to clinic with chief complaint of pain to left upper quadrant, and then let the medical provider depict from there however he wants to progress with the medical note. For divisions, providing reference points. This is used to describe the location of the abdominal pelvic organs. It's also used for clinical examination, reporting, and charting. We just discussed that. The location of the abdominal pain, because there's the reason for this that is so important is there are so many organs and so many systems in play around the pelvic area and the abdominal area that if we didn't have these divisions, it would be almost impossible to identify and pinpoint issues. But if we could start identifying right upper quadrant, left upper quadrant, then it's able to, by process of elimination, get rid of certain diagnoses because that body part wouldn't coincide with that quadrant. So if a patient presents to clinic with chief complaint of left upper quadrant, that's far away from the appendix that we could kind of rule out appendicitis out of the equation. So that's, again, why it's so important to learn this. Another great reason for this is for operative and physical examinations. During post-op and pre-op, you'll be hearing a lot of this anatomical locations referring to where the incisions took place, where things were moved, and so on and so forth. So again, like we discussed, it's like beating a dead horse, but these are the exercises. RUQ, which I already discussed with you guys, we were gonna start changing them up. Right upper quadrant. It's very rare that you will see or read this right upper quadrant in a medical chart. More likely than not, you will see this RUQ or LUQ or RLQ or LLQ. It's just medical terminology. Just like you guys like saying ASAP versus as soon as possible, the medical term does the same thing. Abdominal pelvic regions, all right? Now we're starting to get a little bit more in detail. As we start getting smaller and smaller and smaller, we now can get more in detail as to what body structures are within that region. The positive to this 9-region reference is that it is labeled based on whatever body structures, for the most part, what body structures are located in that region. So for example, the umbilical region, right in the middle, obviously that would house your umbilical or your umbilical cord or your belly button, if you will, as an adult. From there, so let's just start simple. We know that for the most part, everybody's belly button is center mass. So right there. So you got your umbilical region. To the patient's left of that, left lumbar region. Reason being is on your spine, you have your cervical, which would be your neck up here, your thoracic, which would be right around right here. And then you have your lumbar region, which runs right here. We can't call this the lumbar region because it's your umbilical region, but if we go left of that, that's your left lumbar region. If we go to the right of that, your right lumbar region. If we go up, epigastric region, all right, to the right of that, hypochondriac region, right, hypochondriac, left, hypochondriac, and then left inguinal or iliac region. This is because this iliac is your iliac crest. If you guys were to kind of put your hands, kind of your, where your love handles would sit and push down, many of you should be able to feel your iliac crest. So you have a left and you have your right. So your iliac region being right there. And then you have your hypogastric region right under your umbilical region. 9 regions provide reference points. Again, we already discussed that. It's used to describe the location of internal organs, used for clinical examinations, reporting, used for charting. It's used for locating of pain, used to locate where incisions were placed during surgical procedures, you know, location of tumors, operative reports. There's so many reasons to use this 9 region reference. So let's talk about identifying the region. Pertaining to the umbilicals, navel or belly button, you have your umbilical. Above the stomach, epigastric. Beneath the umbilical, so hypogastric. On the left lower side near the groin, you got your left inguinal or left iliac. Remember, we talked about that iliac crest being right there. And same thing on the right, on the lumbar, the right lumbar, left lumbar. All right, combining forms exercise. All right, we got cell, cytoplasm, nucleus. All right, karyo or nucleotide. You got tissues, histology, the study of tissues. Combining forms exercise, we got, for example, your anterior front, antero whatever, and then the rest of the word, or the middle, medial malleolus. Your lower or below would be inferior, and whatever the rest of the word would be. Same thing for side. Side would be lateral. When you're talking about going side to side, would be lateral. Towards the back of the body will be your posterior side, will be your dorsal. So dorsiflex is when you're having your foot and kind of putting it back. Your stomach, we'll be talking about gastrointestinal, blah, blah, blah. When you're talking about your chest, you're talking about your thorax, okay? Your cranium, that's pretty easy because it's cranial. And same thing with the pelvis is pelvi or pelvo. Your abdomen, abdominal, blah, blah, blah. And then your lower back will be your loins, so your your lumbar pain, and so on and so forth. 15, we got red, erythro, white, albino, or leuco, so your white blood cells, leukocytes, red blood cells, erythrocytes. Black would be mellow. Okay, blue, cyano, and then yellow would be jundo. So let's think about it, right? So let's say, Tommy decided he wanted to be crazy and swallow a penny, and then he can't breathe, and he starts turning blue in the face. Cyo, see how it kind of goes together. Yellow, jaundice. Jaundice is a condition that your body starts turning yellow in color because it's not able to get rid of certain chemicals that cause your body to be yellow. Some lists of other CFs, so dry, your extremities, your internal organs, visceral, diseases, or pathology. And okay, so again, this part 2 of this exercise is going to be completing medical words. We'll go with the first one, and then the other 3 you guys can run on your own. But let's talk about destruction of white blood cells. We just went over leukocytolysis. So leukocytolysis, you could clearly see the break of each one as you combine this word to define that is the destruction of white blood cells. Again, going over some more exercises in completing medical words. You can see how when we're talking about the neck, we're talking about the cervical. We're talking about abnormal condition of blueness, cyanosis, and anything pertaining to the loins or the lower back will be your lumbar. Talked about why, you got your lumbar spine there. Pertaining to a disease of unknown origin, idiopathic, okay? Pertaining to the body, somatic. Specialists in the study of a disease will be pathologist, okay? Pertaining to internal organs, visceral. One way to remember this, when we talk about somebody that hurt me at a visceral level, is talking about somebody that hurt me very deep inside of me. So when you talk about the very deep organs, will be your visceral level. It hurt me deeply. Again, building a medical word exercise. What is a white blood cell or leukocyte? Pain in the stomach, gastralgia or gastrodynia. Instrument to measure the cranium or the skull, craniometer. And condition where you have an enlargement of internal organs, visceral megaly. That's pretty cool. Incision to the chest, thoracotomy. Study of tissues, histology. A record of x-ray, radiogram, or pertaining to a deficient color, hypochromic. Yeah, I'm telling you, this gets really tongue twisty. Try saying that number 8 3 times in a row. Good luck. Diseases and conditions, okay? Pathology or morbid condition with a group of signs and symptoms and clinical findings. It disrupts homeostasis. Homeostasis basically is a state where your body is perfect. You know, everything is what it's supposed to be. It's equal. So your temperature, your hydration, your blood volume, your acid, your pH level, all of that goes into homeostasis, which is what your body wants to be. Your body wants to be ideally perfect, which would be homeostasis. Some diseases, some sign, objective indicator of a disease, example, you know, like a rash or swelling. You could clearly take a look at this patient on the screen and see that that is not normal. You know, all that redness would be some type of sign of a disease or a symptom. A symptom is subjective indicator of a disease. Example would be dizziness, nausea, or pain. So if we were to look at Billy here on our screen, what you see would be the sign, right? So that's your objective. Now, if Bailey says, "Oh, I am so itchy," that would be your symptom. Your cause can be metabolic, infectious, congenital, hereditary, neoplastic, or just environment, trauma-based, burns, mosquito bite, so on and so forth. Okay, so let's go over some vocabulary challenge exercise. Adhesion would be an abnormal fibrous band or binding tissues that are normally separated. Inflammation would be your body's defense against injury or disease that limits the spread of an injury and aids in healing. Febrile will be your feverish pertaining to a fever. Morbid is a disease or being unhealthy. So morbidly obese is unhealthy amount of weight. Sepsis would be the presence of a pathogen in the blood or other tissue. Suppurative is producing or pertaining to the generation of pus. Ugh. Now let's talk about the electrocardiogram or ECG. Okay, it's a recording of electrical impulses generated by the heart. Those of you that don't know, our bodies do generate electricity. It's a pretty cool system, and it is very beneficial for us to be able to record the findings of our heart as it works. It's a way that we can detect early sign of a heart attack or some issues with our valves opening and closing. There's many things that can be detected through an ECG. ECG is basically obtained when you place certain electrodes throughout different parts of your body to generate a report. And that report will give you different levels that show you how your body's functioning. A lot of the ECG cards will have kind of a picture that will tell you, all right, V1 goes here, V2 goes here, V3 goes here. If you can paint in between the lines, you could pretty much put these electrodes in the right place and get the correct report. So hopefully you guys know how to color inside of the line. Spirometer, all right, it's a pulmonary functions test. It is commonly ordered post-operative to promote deeper breathing, all right. This nose clip, this is probably an old school one. It doesn't work that way anymore, but okay, we'll call it what it is. Basically, this machine records the results of the spirometer test, and it spits out a report kind of like the ECG does. So continuing with procedures in specific spirometry, this procedure helps in assessing and diagnosing certain types of lung disorders, such as a patient we're trying to rule out or diagnose a patient with asthma. This would be a test that would be beneficial to kind of get the ball rolling towards that diagnosis. It is many times ordered for patients who have had surgeries that may jeopardize respiratory functions. Remember, the lungs are housed in this pulmonary cavity, and it is a vacuum sealed cavity, which means any type of exposure to the atmospheric pressure around can throw our ability to breathe properly off. So this procedure would help identify any issues that we would have encountered post-surgery or sometimes even pre-surgery. Anastomosis is a surgical joining of two ducts, vessels, or bowel segments to allow the flow from one to another. Here you can see a perfect example of three different types of anastomosis, all right, end to end, end to side, or side to side. Not much to say about that other than that. A biopsy, many of you have probably heard of this. This is a removal of a certain sample of your body that will be sent out for evaluation. Sometimes it's just to identify what the substance is, whether we're trying to rule out if this if the cell is cancerous, if it's not cancerous, if it's benign. Sometimes biopsies are necessary to identify what that specific cell is made out of, so that either we can target it for removal or just leave it alone because it's not causing any pain or issues. Here's a clinical related exercise. Mr. L's S vein is exercised and used to bypass an occlusion in one of his heart vessels. Surgery that joins two vessels to allow free flow of blood between them is called, all right, anastomosis. Kind of saw it just a few slides back with the joining of those. Here goes another exercise. Mr. W is told that deep breathing post-operative is essential to avoid lung complications. The doctor instructs her to use an incentive spirometer. This device helps prevent fluid buildup in the, well, it's a spirometer trying to work out on the lungs, okay? With the spirometer, my brother just had recent weight loss surgery. And before he went into surgery, they gave him this device so that he could start practicing and kind of getting his lungs used to working at a certain level so that his recovery would be that much easier because he would have already done the work. Some other procedures, endoscopy is a visual examination of an organ or cavity with an endoscope, which again, what is an endoscope? Well, it is an instrument named for organ or cavity examined. It's used for biopsies, surgeries, and aspirating fluids. Oh man, all of you that are be going into the X-ray program, this is an X-ray or radiography. It is used as an electromagnetic beam and it's passed through the body to produce these images. It's a radiopaque dye possibly required for radiographs of soft tissue. Um, I mean, this is an X-ray. Another procedure we can talk about is the ultrasound. Ultrasound uses high frequency sound waves that are emitted by a transducer or a probe to produce an image of a body structure on a computer screen. Some of you might be, well, why use the ultrasound when we have x-rays? Well, x-rays produce radiation, ultrasounds not so much. So when we're looking at a fetus, this will be a very safe way to visualize what's happening inside of a mother's womb without causing any damage to the fetus. Sound waves are emitted as a transducer moves back and forth over the organ. It's optimized sound transmission from placing that very, very cold gel on the skin. Sound waves from the transducer or the probe reflect from internal structures as echoes, kind of like a bat uses an echo to be able to find its way around. This process or this procedure uses very similar technique. It sends a wave, that sound wave hits a certain organ or body structure, and it returns back that echo at different frequencies, which are tracked by the computer, and the different frequencies develop different images, and that's how we're able to produce the image of the fetus or an image of a vein or an image of an artery using the echoes produced by that ultrasound. This is PET, it's a position emissions tomography, use of a radioactive chemical called a tracer that is introduced into the body. Accumulation of tracer in the most rapid metabolizing tissues. It is positively charged particles that are emitted in the body region and detected by a device called a gamma camera to produce an image. If you were to look at that image that we just saw, it looks very similar to those people that come to your house and they're looking for water damage, or they're looking for AC or heat escaping from your HVAC system, and it just identifies the differences between normal and abnormal based on what was sent in. Continuing with some radiology, we got the MRI, magnetic resonance imaging. This is a very awesome procedure. It's used using radio waves and a strong magnet to produce cross-sectional images. It has exceptional detail of soft tissues. So when you are trying to rule out any type of ligament tear, rotator cuff tear, stuff like that, you would use an MRI machine. Now, those of you going into the radiology field, keep in mind that these magnets are strong. I remember when I was a very, very novice X-ray tech, I brought a chair into the MRI room. I forgot to take it out, and when we fired the MRI tube the morning after, that chair just flew right across the room, making a substantial amount of damage to the MRI machine. So learn your lesson from me. Keep the metal out of the MRI room. Next is your CT. Kind of looks like a donut. computed tomography. It has narrow beams of X-rays that rotate in a full arc around the patient. It requires multiple views of the body at the same time, which a computer then interprets and informs the image. So let's go over some exercises. Record of sounds, sonogram, a process of recording images using frequencies beyond sound will be your sonography or ultrasonography. Instrument to cut through the skin, it's called the dermatome. An instrument for examining bronchi, bronchoscope. Bronchi are located within your lungs, and that's how your lungs are able to exchange gases. Instruments to measure your cranium. I believe we already went over this, but again, craniometer, visual examination within the body is your endoscopy, and pertaining throughout the abdomen, transabdominal. Study of blood, hematology, instrument to measure heat, thermometer. A specialist in the study of X-rays would be a radiologist. That will be your doctor, radiologist. All right, so this concludes this portion of the lecture. I hope that you guys were able to follow through and it wasn't as painful as you might have hoped or thought it was. I can't stress enough the importance of you guys being able to open your books and go through this material on your own as well. There's no possible way I can cram all the information that is covered in these chapters within a 15-minute block of instruction. So it is imperative that you open the book and you read through the material. All the material within these chapters are fair games for your chapter exams, your midterm exams, and your final exams. So make sure you're reading the material. In addition to the material within the chapter readings, you also have some exercises that you guys can accomplish online. And I encourage you guys to move through those. Don't speed through them. Make sure that you're taking your time and that you're understanding the concepts being taught and asked of you. If you don't understand something or you're having an issue with it, then start it again and do it again. It doesn't make sense for you guys to finish fast and in a hurry and then lose the learning aspect of it. Like I've said, all of this material that you're reading within the chapters is fair game for the midterm for the chapter exams, your midterm exams, or your final exams. So please, please, please make sure you're understanding the material. If you have any questions, I'm here for you, and reach out to me, and I will see you on the next chapter.